Hello, this is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my hope for you is that with each passing episode, we get closer to being your own best expert. Today, we are talking stem cells, probably something you've heard about, you don't know much about. What is it? We are talking to Linda Monty and Dr. Chris Menton, chiropractor that went to Life University as I did. So we are kindred souls to begin with. So let's just jump in. Linda, tell us where we would start in learning about this.
So our clinic is Limitless Health and Wellness, and we are in the regenerative medicine space, and we've been doing this for about 3 years now, and we have a full network of clinics all over the United States, and we can help people that have all kinds of different problems, from musculoskeletal, which is like your knees, shoulders, elbows, down to autoimmune diseases, which is something that I have, and stem cells have helped me tremendously with my autoimmune disease, and also Parkinson's, stroke victims, and the stem cells break the blood-brain barrier, so they help. That's why they help so tremendously with stroke victims and Parkinson's, and so it's
Wow.
and also for all of our anti-aging. The stem cells work for that as well. So it's really amazing,
It
Dr.
is
Chris.
like I can hear somebody saying, too good to be true. Like, what is up with this? So, because that's a lot, and it's what do they say? This three C's that concern us most when we age: cancers, cognitive decline, and cardiac. But certainly, I mean, I've been in practice for 32 years, and the amount of arthritis I see in people is just getting worse and worse and worse. So, tell us how that plays a part, Dr. Chris. Like, what, why does this work, and why is it so new, and what's up with it?
Yeah, I mean, the reality is I've been in this space for about 12 years doing regenerative medicine. I have helped kind of publish some articles, done some research on it, and there's still a lot that is left to be known. Even people who have dedicated their entire lives to this, which we have massive amounts of people in our network, some very brilliant doctors, everybody from orthos to neurosurgeons. We don't really know just yet. The human body is an amazing thing, but we do know that this does work. And one of the biggest ways it actually works is by reducing inflammation in a body or in a joint. Because, let's face it, the last few years,
Hmm.
inflammation was kind of a buzzword, right? Everyone was worried about inflammation. And the reality is now stem cells is becoming a buzzword. And so we're going to try to pivot on that. And we're going to try to obviously show people the research that's been going on for the last, gosh knows, 100 years or so. Our network consists of many doctors, and some of these guys are very well esteemed, very, very well and highly regarded within their fields. And some of them have even pioneered some surgeries in their fields. A neurosurgeon actually pioneered one of a lumbar fusion and an SI fusion, and he is now pivoting towards stem cells because he sees the benefit and the regenerative capabilities of it, and even the joints that he thought didn't or couldn't get help. So really the biggest way it works is by reducing the inflammatory response. Stem cells have an amazing ability to kind of go in and restructure, redesign, and potentially rebuild the area that you are having issues with. Now, there's limitations on everything. Unfortunately, if the knee has no cartilage left, then we can't grow cartilage from no cells, right? So we do have to catch you before a period of time. Linda was mentioning some stuff along the lines of neurodegenerative disorders, autoimmune disorders. If we can catch those earlier on, say Alzheimer's, Parkinson's, TBI, strokes, we can get tremendous results from those things because what we once thought couldn't happen can actually happen. The biggest thing was no one thought that the blood-brain barrier was permeable. Well, we know that to be false now because these cells become nanoparticles, or certain parts of the procedure or a stem cell can actually become nanoparticles, or they're already designated as extravascular vesicles that they can actually cross those blood-brain barrier and actually start helping in the regenerative process.
So let me jump in and just clarify something for the audience, because I can hear one or two saying something like, are stem cells from babies? And I think back 20 years ago, maybe that was the case. But where do we get the stem cells from now?
Yeah. Yeah. So there was obviously stem cells that were from aborted fetuses and things along those lines. That is obviously not ethical. We don't do that. Nothing is happening. And that's actually something called allogeneic. So allogeneic means that you get it from a donor, whether that's a baby, whether that's another human being, because stem cells can be passed from one person to another, provided that they're actually broken down and certain blood is removed. Because they sell those products all the time. I'm sure people have heard of umbilical cells. I've got, I had a friend of mine, he went and got umbilical cell stem cells and he's doing great from it. Well, that's an allogeneic product, okay? What we specifically deal with is something called autologous, which means it is from your own body. So there's a couple different places you can get stem cells readily from the body. You can get them from bone marrow. The problem with bone marrow is they're chronologically your age. And also, if you have some other issues going on in the body, they may not be as potent as, say, the ones in your fat cells. Adipose-derived or fat cell-derived stem cells, in our opinion, are much better. We have research to show that. And the reason being is because of telomere size. So telomere size is the ability for the cell to regenerate, or the activity level a cell has the ability to heal or act upon another cell and signal another cell.
All right.
Um,
So
yeah,
I'm going to interrupt you for just a second. So
please.
just so the audience knows, so what we do here in stem cell therapy currently today is that we take your own fat cells from your butt, your glute, your side, and something is done with those to spin them down or separate the parts of it, and then um, those are re-injected. And there was something else you just said I wanted to clarify. So it's your own fat cells. Oh, and the good thing about fat cells is they're not old like you are. They are
Yeah.
younger for some reason. And telomeres that Dr. Chris just mentioned, those are the kind of like shoelaces at the end of the DNA. And the DNA is a circular strand, and these telomeres protect it. As you age, whether you're whether you're a 50-year-old in an 80-year-old body, or an 80-year-old in a 50-year-old body, those telomere lengths, as your body ages, get shorter, so your DNA is not as protected. So you're saying
Yes.
that fat cells have nice long telomeres. They
Yes.
might be 20 years old when I'm 60 years old.
Yeah.
So they're
Well, we've actually been able to put an age on it, and
really
it's essentially, yeah, it's actually essentially 1/10 your age. And so we have the studies to show that, because we've taken patients from as young as 20 years old all the way up to about 86 years old, and we've taken blood from them, we've taken bone marrow samples from them, and we've taken adipose samples from them, and we've measured telomere size up until the age of about 35-ish, 40-ish. Bone marrow and telomere size and adipose telomere size are roughly comparable. But as we start to creep over, the 45 to 50-year mark, then all of a sudden it doesn't become as comparable. Bone marrow starts to lack its telomere size and the ability for the longevity aspect to take place.
hmm
And that's what's really nice, is because I always say this to a lot of patients: you can use your own body to help heal itself. It's not that difficult. You can do really inexpensive things, which cost you next to nothing, and you could do really expensive things depending on the severity of the case and what you have going on. But I do like to point out that if you can ever get the product from yourself, right? And so you were mentioning we take the cells out, we do a mini liposuction procedure where we take just about enough to fill up a Coke can, and we then add it to a proprietary kit. And then that proprietary kit is spun and it's ever so shaken. And what ends up happening is the end product, after about an hour and a half to 2 hours, we have something called Stroma Vascular Fraction, which is what I like to say stem cells on steroids. Because it's not just stem cells. And one of the big words that I like to use is something called mesenchymal stem cells. Mesenchymal stem cells are the stem cells that everybody's vying for. It's what is essentially undesignated in the body and can eventually go and do the work. They communicate. They help. It's like a symphony orchestra in a sense, where you have that person guiding the symphony or guiding the orchestra on which to play and when to play. And stem cells do that. They modulate or mediate or speak to other cells to help do work. And that's the biggest thing that you can do for your body, is have those cells put into an area where you have chronic inflammation or a chronic issue that your body can't overcome. And then it can help heal with the ability of stem cells being put in those areas. And that's all done via telomere size and then obviously the communication. And like I was saying, a lot of it we don't necessarily know. We don't necessarily know how all these cells communicate, but they do. And we're finding out more and more each day. And the reality is we're in such a great position now. The next, I believe, 4 years or so are going to be pretty critical because we have an administration who actually is stem cell friendly and peptide friendly. Okay, which is great because they're looking less at pharmaceuticals and they're looking more at your own body's natural ability to heal. Which why would you not want that? Because anytime you put a foreign product into your body, even an allogeneic stem cell product, you could run into issues. Your body goes through basically a cytokine response, or it goes through an inflammatory response to those cells because they may have DNA or DNA remnants. It's foreign. And so your body's always going to attack some of that. Now, that doesn't mean that umbilical cord cells can't work or placental or amnio, but the reality is they're not all equal. And a lot of terms are thrown around a lot. PRP is probably the biggest one that I hear a lot. Saying, "Oh, I got stem cells done before."
Yeah.
Okay. Well, what was it? Oh, it was PRP.
What's the
Well,
difference?
yeah, PRP is not stem cells; it's platelets, and it comes from your blood. What we do is we separate some of the junk or debris from the blood, and we grab this plasma or platelet-rich plasma, and then we can re-inject it into the area. The biggest example or the best example or analogy I like to give is PRP is similar to fertilizer. Okay, we can plant a seed and the seed will grow on its own, but the reality is it grows better with the fertilizer. So PRP is a fertilizer. It helps what is already there work a little bit better. Now, if we add stem cells directly to the area is going to work much, much, much better. Okay, and sometimes we can combine an allogeneic product and combine PRP and get a better result. So there's different things that you can do. PRP is fairly inexpensive. It kind of runs anywhere from $500 to $1,000 per injection. Now, stem cells can range, and it can go all the way up. There's places in Mexico that charge $45,000 for umbilical cord or allogeneic products. I'm not a big fan of those. I know people have actually gotten that done, and they've had success. But quality control and human error plays a little bit bigger of a part into that. What is really nice is I just had a call with a doctor this morning. It was awesome. He's a triple board certified ortho. And him and I got into a really great conversation. We're just saying that there's nothing like getting your actual cells the same day we actually do the tissue harvest or the lipoaspirate. Okay. It is incredible the difference between what you get same day versus a product that gets collected, shipped off, broken down, frozen, sent back to a provider like you or someone else or myself, thawed, and then re-injected into a patient. So there's a lot that can happen in between the time of collection to the time of actually getting to the end user, where this is all done same day. It's really wild how you can do this.
Looking at your Limitless Health and Wellness website, and essentially what you do is you, under hygienic conditions, you draw that fat off of the person, and it takes maybe what, a half hour or an hour or something.
It takes roughly about 20 minutes to actually do the
20
harvest.
minutes. And
Yeah.
then they get up and go to lunch and come back in an hour and a half. Meanwhile, it's been spinning, and that same or that differentiated substance, that drawn off substance, which is the SVF, the Stroma
Yes.
Vascular Fraction, which
Correct.
on your website, one of your founders said it was a soup, a wonderful magical soup of stuff. And
Very
that
true.
gets injected into a joint or area where the person perceives a problem. And
Yes.
the equation I make, and you being a chiropractor will understand this, like I'll do an adjustment on a patient. I don't know what's happening. Like I just do the adjustment and then the body takes over, and that's where the magic is. And it sounds like it's the same thing with stem cells. You inject these to an area, maybe a knee, maybe a spine, um, and then the body will not only use it in that area, but it will use it in other areas in its own wisdom where your body needs it. Is that close to correct?
Yeah, no, I mean, you pretty much nailed it on the head. The realization is that we can never think that we're smarter than the human body.
True.
And there's a lot that we don't understand on why our body regenerates. And unfortunately, a lot of the times, these pharmaceuticals, all they're doing is creating a band aid, and they're not necessarily creating a cure, right?
Not at
And
all.
some of the times I'll say is that the cure is worse than the disease, and there's things that can be done differently to actually help your body facilitate healing. That's what I think a chiropractic adjustment does, and some of these other things do, including stem cells. They help facilitate healing. They help the body, when it's stuck, just work better and help heal the body. So yeah, I
Right.
mean, you pretty much nailed it on its head.
Now, what about that person that says either, like I said earlier, oh, it's too good to be true, or I'm too far gone? Like, how far is too far for, say, arthritis?
Yeah, I mean, the reality is that it's hard to predict that, because if I had a dollar for every time a patient came in and said, I'm bone on bone, you can't do anything about it, I'd be a millionaire, because, stem cells actually can help. And I'll use my mom, perfect example. I literally just did some injections on her knees today. Okay. My mom was a bilateral knee replacement candidate. Okay. From her ortho. And since I've been doing this for so long, I said, Mom, let's start doing some of your own stem cells. Let's start doing and experimenting. And so what I did was I just did some of her own stem cells today that we actually had at a lab, and I mixed it with a little PRP, and we did an injection into both of her knees. Well, we've been doing this now for about 4.5, 5 years. And the reality is she was bone on bone, like we hear from her, many orthos. And now you can actually see it in an X-ray and an MRI, and you can see the thickness of the cartilage actually growing back. It doesn't
Wow.
mean that she's not necessarily still a candidate for knee replacement, but now we've been able to ward that off for much longer.
Right.
Now, if I would have been doing this, say 20 years ago, I think we could have saved my mom from double knee replacement.
Right.
But for minor things, provided they're not like full tears, right? Because sometimes if it's a full tear, if it's retracted, stem
Right.
cells aren't going to heal that.
No,
There's
no.
sometimes things just are surgical. And we have statistics on pretty much everything. But by no means are stem cells 100% bulletproof. But I will tell you this, they will never hurt you if they're from your own body. And the reality is it's worth a try to many people to say, hey, I'm going to give this a go, because surgery should be the last ditch option for all of us, right? Especially spinal surgery. So you
Absolutely.
have a spinal surgery, and I'm sure you've seen this, Nancy. You've probably educated some patients on, hey, listen, I don't think you should maybe go through with that, or
Oh,
here's
yeah.
my opinions on that.
Oh, yeah.
Then they go and they get the procedure, and they come back to you and they're like, I need help.
They're
And
just
you're
as
like,
screwed up. Yeah.
I'm like, I'm sorry. I wish I could help you further, but I cannot. And that's the biggest issue, because I think people in their heads are thought, well, my insurance is going to pay for it and it must be good. And my doctor is doing this because he knows best.
Right. Right.
And I hate to say, I giggle at that sometimes, because, go check what type of car your doctor's driving, and that'll kind of tell you if he's
That's
doing
a
it
good
for the real
point.
reason.
Yeah.
Now that doesn't always mean that. And there's many good orthos that I deal with on a daily basis, and spinal orthos, knee, shoulder guys, wrist, elbow, that are
But
wonderful people.
But
And
there's
we do,
limits to their tools.
yes,
There's limits to
exactly.
their tools. They have pharmaceuticals, they have surgeries, maybe some physical therapy. I actually specialize in people that have already had spinal surgery. I'm able
Yes.
to work with it. And oh, so that brings up a question. If somebody has had a surgery, say on their spine, can they
Mhm.
still do stem cell therapy?
We can. And we just have to be very careful. Anytime there's hardware in the body, we want to make sure that we're not injecting in that, because you can obviously, increase the
You,
risk of infection.
and you don't want to stimulate extra calcium deposits like
Bingo.
hyperostosis or anything like that in that area. That makes sense.
Yes,
Um,
exactly.
and let's see. So before we got on air, you said that there were stem cells are created by our body, can be done spontaneously if we do certain things on our own.
Yeah.
What's some of the simplest things that somebody can do?
Yeah. One of the simplest things I tell people to do is, if you want stem cell activation in your body, you can actually simply just water fast. Now, you have to be very careful with that. And obviously, we want to do it under doctor's supervision, because if you're diabetic, that's probably not going to work very well. But the reality is that if you go into a water fasted diet, which means that you're drinking only water, and really kind of the big number is like 3 to 5 days. So 72 hours to 5 days, you'll start to get an immense amount of stem cell activation, because guess where the stem cells get released from? They get released from every part of your body, but they also get released from fat tissue,
Oh, makes
because
sense because you're going to burn fat.
exactly.
There you go.
What are you going to use after you used up your carbohydrates and your sugars? After you used up protein, you're going into ketosis. You're going to have to use something in your body to help heal you if you get hurt. And there's something called autophagy. Autophagy is the body's kind of eating up its own garbage and basically only keeping what it needs. So it's the body's garbage disposable to get rid of those junk cells. We also can call those somewhat senescent cells, which are
Senescent
zombie
means,
cells.
zombie cells. Okay.
Yes, zombie cells. Yeah. So those are cells that are just taking up space. They're not necessarily hurting you, but they're not actually helping you. And so if we can start to get rid of some of that junk, the body will really start to release its own stem cells, and you could actually start to heal your gut. You can start to heal autoimmune diseases. You can start to heal normal inflammatory processes in the body because you're regulating the metabolic aspects of the body. There's a bunch of things that you can do that can actually really help your body. And that's probably the cheapest way to do it. You get some good quality water, get it nice and filtered, remineralized, because you want the minerals in there. You need that. You can even use some mineral salt. Like I use Baja Gold a lot, but Celtic sea salt works as well. And you could add that to a water bottle, and you could drink that throughout the day. The only problem that I see with that is patience discipline. Many people find that very difficult because we're so used to eating, in excess. But the reality is if you're already doing like intermittent fasting or you're doing things along those lines, it's really not hard to stretch that into a day, 24 hours to 2 days to 3 days. And some people do have to work up from it, but that's probably the most inexpensive thing that you can do to help heal your body. And patients often ask, how often can I do that? I tell them, you can do it once a month. You could do it once every quarter, whatever you want to do. And it really depends on the severity of your issues because this is not a cookie cutter approach. We don't have a one size fits all. Everybody's so individualized. What might work well for you or for Linda might not work well for me. And so we have to, that's why I always say, work with a practitioner who knows what they're doing, work with someone who understands what your previous injuries and issues are, and you'll be much better off. You do have to be monitored somewhat with that or have access to someone you could call in the event that something's not going
Sure, definitely. Yeah, do it with either a coach or
yeah,
somebody that's versed in that.
right.
What's the next or the next easiest thing to do to produce stem cells?
Yeah, the next easiest thing to do is probably using something called PRP, like I had mentioned, which we get from the blood. We spin it down and we grab those platelets that are rich in healing capacity and the plasma that's rich in healing capacity, and we can inject it into the joint. Like I said, fairly inexpensive. It'll probably charge, people probably charge anywhere from $500 to $1,000 per injection, which is about the going rate. On top of that, you can then add an allogeneic product to it, which then will probably bump you up another couple $1,000s.
So the allogeneic, that's from another source. That's like stem
Correct.
cells, umbilical stem cells, or something like that.
Yeah, yeah. We have a product called Stem Force. Me and our co-founder, we have developed this product called Stem Force, and it's an adipose-derived product. If people cannot afford the full procedure, which we fully understand because it is
Right.
expensive.
And the full procedure, it could be like $20,000
Yeah.
plus, depending.
Yeah,
Okay.
it can range anywhere from $17,000 to potentially $25,000.
Okay.
And everyone always asks me, well, why is it so expensive? And the reason I say it is because of the proprietary kits that we have to use and the machinery that we have to use and the time it takes. The reality is we don't have an assembly line of this stuff waiting to just be purchased like you do on Amazon. This stuff is built to order, right? So, a lot of the times we have to really purchase our proprietary kits well in advance because the assembly line could take a while to get these things going. And it's supply and demand. The more demand there is, the more supply there will be. Well, right now the demand is high, but unfortunately the supply is low. So we're trying to really make this standard of care, and we'll be much better off, and then the price can come down.
Right, right.
So yeah.
So
There's a couple important things too to touch on. When aside from just injecting the stem cells into a certain area like your knee or your shoulder, you're also getting an all-over generation by getting an IV. What the IV does, yes, all the patients get an IV as well. So once the stem cells go into the IV, you're getting the stem cells are finding the hierarchy of the problems that you don't even know exist. We don't know what's happening in our body, as you said earlier. Once you give something an adjustment, you don't know what's happening. Well, when the stem cells go into your body, we also don't know where they're going because we don't know the damage you have in your body, but they do. So they go and find the damage, they find the inflammation, and they will turn themselves into what they need. They might turn themselves into cartilage or a tendon or a ligament, or they find the disease cells, they kill those off, and they replace them with these young stem cells that have long telomeres. The other thing is that these stem cells can be banked. So we send them to an FDA compliant cell bank after we're done giving you an injection, after we're done giving you an IV. We save a very small amount of them, and they are sent to an FDA compliant cell bank. They store them, they grow them, and then you have enough for the rest of your lifetime. So it's like having your own pharmacy.
Wow.
So the next time you hurt yourself, you can just have them FedExed in. Then you might want a once a year all over regeneration, which a lot of patients do. They're like, well, I just want to keep flooding my body with these wonderful young stem cells. So once a year, or some people do it every 6 months, they just flood their body with these young stem cells.
Wow.
And they're fixing the damage in their body
Cool.
all over.
Cool.
So the banking is really a phenomenal insurance policy, I guess, like having your own pharmacy.
That is awesome.
I mean, the best thing you can do is avoid surgery and drugs, right?
That's the best thing you can do. I mean, and that's what people want to do. So tell me about the stem force. So what is that?
Yeah, the stem force is an allogeneic product or from a donor, and it mimics the Stroma Vascular Fraction procedure that we do. Okay, so it's everything but your own cells. Okay,
not from
so
your
it is
own
a
cells.
It's not from your own cells, but it has pretty much everything that Stroma Vascular Fraction has. It has exosomes. It's got a lot of other growth factors in it. It's got other amino acid chains. It's got other peptide chains into it. And it's actually very powerful. So what I try to tell patients is instead of just getting one product, like you would have to get an umbilical cord stem cell product, and then you have to get an exosome product, and then you have to get PRP, and then you have to mix all those together. Stem Force is really all of that put into one. So we feel it's a far superior product. There really, in my opinion, isn't anything else out there on the market like that. I try to tell everybody it's kind of like the Cadillac or BMW or Mercedes of the allogeneic products. And it's made in the same lab where you can actually expand your cells out at. So their quality control is extremely high. Like Linda said, they're FDA compliant. They actually received 100 a review from the FDA on their most recent inspection, which, you know, if you know anything about CGMP facilities, no one ever gets that. No one ever gets 100% on that. It's like they'll give you a 98 or 97. They're not giving you 100%. And so, in other words, we utilize a facility that is well above board. It's not a fly-by-night place. They're an FDA compliant tissue bank where they can actually grow other types of cells. And they've been doing this for years, and their quality is extremely high.
So what's the benefit for somebody to pursue that versus an allogeneic product or PRP or going the route of just doing the stem cell therapy? What's the benefit of Stem Force?
Well, Stem Force is it's nice because, you know, it's something that's less expensive than the full procedure. Again, I want to make, you know, a recommendation that if you can afford autologous cells on your own, if you can afford the full procedure on your own, in my opinion, that's what's best. Because again, it is 100% your DNA. There is no foreign DNA in it. The allogeneic product will have obviously foreign DNA in it because it's from someone else. There's no way to, no way around it. Even exosomes, which are nanoparticles, which are different than, you know, MSCs or stem cells, they still have remnants of RNA in it, which is parts of DNA. And so you still can have, you know, an autoimmune response or, you know, a cytokine response to that. Some people do, some people don't, you know, but we just don't know. But it is really nice because if someone cannot afford the full procedure, but they just have a simple issue like knees or a shoulder issue, they can just simply get the allogeneic product, spend far less money. They don't have to go through the whole thing. They don't have to send their cells off to get banked. And it does work. It works very well. And the ability is that's what we're kind of used to right now in the industry. Everything is pretty much allogeneic. There's very few autologous products. Or autologous. The only other autologous procedure that I'm very much aware of would be bone marrow aspirates, which again, we kind of talked about that. The more you age, the less telomere length is on those cells. So the less ability it has to, you know, regenerate. So, you know, in my opinion, Stem Force is a good second place or 1B instead of 1A to your own cells, but it's a quality product. And in my opinion, I always want to know where my cells are coming from. I want to know that the lab is reputable. I want to make sure that they have good standards, that they're on the up and up. And this facility does have that. And they've checked off and they're proud of it. And believe me, they definitely will let people know, like, hey, look, we got 100% from the FDA. Who the hell gets that? So, they're very much proud of that. So
So the
that's why I feel comfortable.
quality is there and the
Yeah,
safety is there. And
correct.
so, and you say it's probably good for simple things like
Simple things.
shoulders, knees, maybe uh, thinking rheumatoid arthritis in the hands or the
Yeah.
wrists or something like that.
Yeah.
Um, and it's accessible. It's more accessible because it's not a surgery suite where you have this whole process same day and all of that.
Right. And the reality is too, is it can be done in minutes, right? It takes about 10 to 15 minutes to thaw the product. And honestly, depending on the person who's doing the injections, I mean, I can do injections in 2 to 3 minutes. It's super easy. It's not hard.
Right.
You
Right.
do it in a sterile field, and for anyone who's ever done an injection before, it's extremely easy. I always tell people, if you got a cortisone injection, well, this is no different, but the site doesn't change, but what's in the syringe does.
Uh-huh.
And so instead of it being cortisone, now you have a regenerative property, because any ortho or any doctor worth their salt will tell you how detrimental cortisone is to a joint.
Yes.
It is
Yes.
awful. It is
Awful.
awful. And
Breaks
I'm
down
not,
bone. Hmm.
yes, it does. It eats the cartilage, the hyaline cartilage that's inside of that, the synovial fluid. It gets rid of that within the joint. That's your lubrication. When you start getting rid of that, you're going to expedite and essentially increase your likelihood to get more arthritis in an area where you already have arthritis. So
Yes.
it's not regenerative in nature. It's actually destruction.
It's destruction.
And I try to tell patients that, and then it makes sense, because they're like, yeah, I've had 4 cortisone injections, and the first one worked great. It worked for like a year or 2 years, and then I got the second one. It was only 6 months, and then I got the third one. It didn't work, and then the fourth one, I got nothing from it. And that's the problem that we kind of run into. And we want to get to people before that issue happens. That's why I try to tell people, get involved with someone who knows what they're doing. I think we're going to see more stem cell facilities popping up. Make sure that they're reputable. You're more than welcome to come to ours. You don't have to come to ours by any means. But the reality is make sure they know what they're doing, and make sure that they really are using the most recent studies and the most recent research. Because anytime you become antiquated in your ideology or your philosophy on how you do things, or that doctor's unwilling to learn new things, you might be stuck. Now, there's some try and true things that have gone, through, like PRP is very, very well done and vetted, and there's nothing wrong with that. But stem cells are really the next thing that can help patients.
Mm-hmm.
So
Mm-hmm.
I mention that to people a lot, and but everyone's confused by it, and so hopefully this will demystify and clarify some questions that patients had. By no means can you do a good job of explaining everything and the complexity of stem cells in 30 to 45 minutes. But as long as they can wrap their head around what they're looking for, what they should be looking for, I think they're going to be much better off.
Yeah, I think the bottom line is that it's allowing your body to heal where it knows it needs the healing, and it's readily available from your own body. Um,
Yes.
and that although the buzzword stem cell has been around for a while, this is really new as far as being like same day accessible. Um, and as time goes on and more people testify to the fact that, yeah, it helped me with this, it helped me with that, it helped me with all these various different ailments and chronic problems and new problems, it's just going to grow, I think.
Yeah. And the one thing I do want to make mention of is that stem cells are not new, right? It's a newer word that people are hearing more of, because I think it's being thrown around, and that's great. Um, but the procedure that we do, this lipoaspirate that gets stromal vascular fraction at the end of it, it's been done since the early 90s. There's been over 25,000 of these procedures done. So it's
Oh,
by no
wow.
means are we just working on something new that came out last year or the year before. I mean, there's over 25,000 documented SVF procedures that have gone on just within our network. That doesn't include worldwide. That's just our network internally here in the US. Because obviously Europe has a little bit different of a view on stem cells than we do here. There's some countries that are very stem cell friendly, and others that aren't. But the reality is, unfortunately, because the pharmaceutical companies have kind of been blocking,
Right.
the natural regenerative properties within
Right.
a body. Look how they took out peptides,
Yep.
a couple of years ago, which
Hmm.
were extremely helpful, like, BPC 157, certain things along those lines. I'd much rather have a patient get an injection of that than cortisone.
Exactly.
So there's things that you can do to avoid that. But the reality is that this is not new. So I don't want people to be like, oh God, I don't want to be a guinea pig here. I don't want
Right.
to do it. Oh God, it's
Right.
been done. It's been getting done for the last 30 plus years, 40 plus
Right.
years.
Right.
This particular procedure.
I think
We're perfecting it.
it's more
But
outside people's back door now.
yes.
As I talked to one of your founders from Limitless yesterday, he said that there's 8 clinics just with Limitless, and that's only in Limitless Health and Wellness.
Yep.
It's not the others.
Yep.
The
Yeah.
nice
John.
thing is
Go
also
ahead.
that patients now have options. They have options to start healing their bodies naturally where they didn't have options before, right? Everyone followed a path of what their doctor told them. This was my doctor told me to do. He told me to get this surgery. He told me to take these drugs. He told me to take, but now people have a little bit more control of their own health, and they can start doing things like this, and like Chris said
Absolutely.
earlier, you can get the gold standard of the full SVF stem cells, or you can do some other things that are maybe a little bit less. You could do stem force, but you do have options now
I love it.
to
I
start
love
healing
it.
naturally.
This has been an awesome conversation. I have so much more clarity now on the different available things and how it really works. So I have one question you can answer individually to wrap it up. If you had a billboard for all to see, what would it say?
Go for it, Linda. You can go first.
It would say, Linda, you can go first.
No, I would say, and I'll go first then, Linda. You can get a second to think about it. It would say there is hope, there is options, and the ability to heal is within you. You
Yeah,
just have to find it. It's as simple as that. That's the reality, is that no longer is it unobtainable. I know I'm saying more than a billboard would say, but I'm trying to get to the gist of it, is that you guys can heal yourself. You don't need pharmaceuticals. You have the ability to heal yourself most of the time within your own body. You just have to find it. So
love it. Thank you so
there you
much,
go,
Dr.
Linda.
Chris.
Go for it. You're welcome.
I would just say, have a few words up there that just say, listen to your body. You have a choice.
Yes.
Simple.
Yes, you have a choice. I so totally agree because you think about when people are they're looking at having a surgery and they know the outcome is very questionable and they know they're going to be different, but they don't
I
feel
don't
like
think
there's other
people
options.
realize the risk involved every time you have a surgery. I think they just think it's safe because it's just so common. Nature, everybody does it. I don't think they realize the risk to anesthesia, being put under and of it not working. There's a lot of risks involved that people don't really think about.
Yes, the infection, the
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 infections,
staph,
right?
the MRSA, yeah,
The healing time, the physical therapy, everything that goes with it before and
scarring.
after is a lot.
Yes, absolutely. I totally agree. This has been awesome. Thank you so much for spending time with me. I'm going to wrap
Thank
it
you,
up with
Dr.
my
Nancy.
audience. You're welcome. So
Appreciate it. Thank you.
for all of you out there, thank you for being with us today on your Healthcare Arsenal podcast. And as always, my hope for you is that with each passing episode, you get closer to being your own best expert. Bye for now.